How is everybody doing? Welcome back over here to our live session today. I am Dr. Anshul Gupta, and it is a very big pleasure to see all of you again today on our live session. So it's really a pleasure. So yes, so we will be today talking a lot more about inflammation. That's what we have been talking about for some time now, and we are going to continue a series of talking about inflammation. What other natural ways you can utilize to improve this inflammation? So that's what we're going to talk about today. So yeah, please introduce yourself into the chat section. Who you are, where are you joining us from? As any specific things you want to share about you is always nice for me to know. Any fun fact or anything you are going through or anything that comes to your mind. It's always nice to kind of interact that way with people. We will be definitely going through your questions in the end. So please don't post your questions now, because then they get buried into all the other things, and sometimes I'm not able to see those questions later on. So we will definitely take questions in the end. As you know, the format is that I will do a presentation first about some things which I feel are important for you guys to know, and then after that is where we open up for questions in the end, so we can answer as many questions as you. So yes, so please introduce yourself. So yes, Shelja is here. Priyanka is joining us from Delhi. North Carolina, somebody joining us. Isabella is joining us from San Antonio, Texas. Welcome over here. Omphaline is joining us from France. Again, Reva is joining us from India. So wonderful. That is great. Carol, nice to see you again. So welcome over here. Keith is joining us from England. So that is great. And Karen is joining us from Jamaica. William is joining us from Chicago. Stephanie is joining us from Van Island. So that is great, guys. Literally we have covered so many different continents, from Europe to UK to US to India, to Jamaica, Caribbean islands. Oh my God, so this is awesome. So thank you again, everybody who is joining us. It is so nice to see people coming from different places and joining us, so we can reach people all over the globe. And that's what my goal is, actually, to reach 1 billion people, and then improve their health. So that's my mission. I hope you guys know about it. We are very still in a very initial stages of our mission, but with hopefully in the next few years, as we continue to provide more content, reach more people, that's the goal, to help people out, not just in general reaching people out by views, but actually making a difference in their life. So that's what I'm hoping, that the videos which I'm sharing, and as well as these live sessions we are doing, are making actual differences in your life. I don't want to give you fluff information which is not useful. I try to give practical information that you can actually implement in your daily routine, so that way you can improve your life. And inflammation is a big reason a lot of people are suffering from chronic diseases. So that's what we are doing. We have picked up this topic of inflammation because what I realized was that almost each and every chronic disease, whether it's thyroid, Hashimoto's, hyperthyroidism, Graves', autoimmune diseases, heart diseases, diabetes, cancer, blood pressure problems, all of those things, the root cause is the inflammation. And once you start working on this inflammation, you see a significant improvement in how your body is functioning and how you're feeling. So that's the reason I want everybody to start with working on their inflammation first. And then obviously there are specific protocols that can be utilized for each and every person based on their health, their body's profile, as well as what is happening. So that's what we keep on doing. But yes, so we will be keeping working on things for you. Today's topic is all about natural supplements. So first week we covered the diet, which is, or food, which is best for inflammation. Second, we worked on gut inflammation, because they have all the inflammation starts in the gut. 70% of the immunity is in the gut. Now I'm talking about specific supplements that you can utilize to go to the next level after you worked on your diet, after you worked on the gut. The next level is working on specifically on the natural supplements which can utilize to help in these scenarios. Okay, so that's what we are doing for you. So great, a lot of people have joined, from Guyana. Welcome Michelle over here. Rajiv is joining us from Assam. Dolapo is joining us from Dallas. Lauren joining us from Texas. Manju joining us from Bangalore. Great. Somebody joining, Salma is joining us from Mauritius, which is awesome. So Anand is joining us from Trinidad. So that is great. Yes, so wonderful, guys. Thank you so much for joining us. As I said, a lot of people have already started putting their questions over here. So as I said, please hold on to your questions because they might get missed. I will like you to put your questions later on once I'm done with the presentation. And so that way I am able to reach out to them. Otherwise they get lost into all the things which are happening. So let's get started. So I'm going to do a presentation first on the natural supplements which can help you in improving your inflammation, and then we are going to open up for question and answer. So let's get started, guys. Okay. All right, so let's get started. So first, as I said, I would like to give you a brief presentation in terms of natural supplements or natural compounds which have shown in research studies that they can help in reducing inflammation. So that's what I'm going to share with you, exactly the list of natural supplements, what are the typical dosages and forms that you can utilize that can help you to lower inflammation in your body. So I hope this will be a good accompanying guide for you to use these supplements along with the diet and the other changes that we have discussed. So let's get started. So this is where we are talking about the supplements. As I said, hope you guys know me till yet is that I worked at the Cleveland Clinic Functional Medicine Center and have made various protocols specifically focusing on inflammation. So the root of modern illness, as you know, inflammation, why that is important? Because obviously that leads to various diseases, autoimmune diseases, even all the chronic diseases currently, their root cause is inflammation, whether it is cancer, heart disease, diabetes, whether it's infertility, whether it is weight issues, thyroid problems, whether you're feeling tired, brain fog, joint pains, all those things, the root cause is the inflammation. So that's more important for you guys to work on inflammation so you can reduce it. Hopefully, like you saw my journey beforehand, which, the video that we have released, where, how inflammation was impacting, and with just simple routine of lifestyle changes with some basic supplements, which some of them I've included over here, was a game changer for me, improved my life, lost 40 pounds, gave me a lot of energy. My mental clarity was better, my eczema, my fatty liver, my gut issues, all those were gone. So that's the power of working on inflammation. Now, what's the problem with supplements, right? So this is where I will kind of, spend some time because, this is a problem which I see in all of my clients who start working with me. They always say, well, we are on supplements. We have been using supplements for a lifelong. Well, the problem is that the supplement industry is not regulated world over, whether it is United States, whether it's India, Europe, or anywhere else, right? So nobody's regulating the supplement industry. So I can just simply say that this pill, has this amount of omegas or curcumin or anything, but I don't have to prove it, or nobody's checking whether that is true or not. So that's the reason it is very, very important for you guys to research the brands where you're getting the supplements from, and only which you feel comfortable and that those are good quality, those are the only ones you buy. The second thing is that either the supplements have ingredients which are underdosed or poorly absorbed, because only certain forms are basically absorbed in the body. Okay. And again, you might, for example, the most common supplement which I see this happening is magnesium. Most people are on magnesium supplementation, but they are on magnesium oxide or magnesium carbonate. Those are very poorly absorbed in the gut. In fact, they irritate your gut and make it worse. So that's the reason you need to use better forms of magnesium. So similarly, it's very important to do that. And then, so that's the reason you have to look into the supplements clearly. As a disclaimer over here, or today's presentation, definitely I'm going to show you some of the supplements that we carry. But the goal is to actually make you aware how to read the labels of those supplements, so that like, what is a good quality and what is not a good quality. Obviously, like, you can buy from us, but, it's not a necessity. But yes, that is a disclaimer I want to put out over here, that yes, shamelessly, I am going to show my supplements, but just to educate you guys so that you will know that what is a good quality supplement. So there are three tiers of supplements that helps with inflammation. One is foundational support that, almost everybody should need. Then the second tier will be a targeted approach for inflammation, and third will be in just generalized approach. So what is foundational approach? Foundational approach, the first supplement over here is omega 3s. Why are omega 3s so important? Now, omega 3s are important because each and every research study shows that, omegas, especially EPA and DHA, can help you to lower inflammation in the body. The reason being, each and every cell of your body has a cell lining, and those cell linings are made from fats, especially omega 3s. And when your body is low in omega 3s, that cell lining gets damaged or destroyed. And that's the reason people will have leaky gut issues, people will have leaky brains, and inflammation, rages very high. So that's the reason omega 3s are very, very important, each and every person, for various reasons: to keep your heart healthy, to keep your brain healthy, to lower inflammation. If you have autoimmune process, if you have thyroid issues, anything you have, omega 3s will be one of those foundational supplements that each and every person should be taking it in good quantities. And over here, so obviously the best source of omega 3s are your fishes, whether it's salmon, sardines, tunas, all those are great sources. If you're a vegan or vegetarian, this is where a problem is. We have some sources of omegas like chia seeds, flax seeds, and walnuts, but these are ALA. Okay, these are not actual EPA and DHA, and that ALA needs to be converted to EPA and DHA. Okay, so these are the vegetarian sources. These are the food sources, especially fatty fishes. The problem is that you have to eat these fishes a minimum of 2 or 3 times a week to get enough omegas, because one serving of fatty fish, whether it is salmon or sardines, will give you around 500 to 700 milligrams of omega 3s. So that is not enough as a therapeutic dose. Okay, so you have to eat them in 2 or 3 times a week to at least get the enough omega 3s. Now the problem, as you know, is that a lot of the fatty fishes also are high in mercury. Okay, so people, come to see me, like, we are not getting better. I check the mercury levels and it's super high. And, because of, they have heard online that omega 3s are important, so they start eating fish, which is high in mercury. So these are the problems. That's the reason a lot of times people go with supplementations. So why EP and DH are important? Because they reduces cytokines like IL-6 and TNF alpha. These are all mediators of inflammation. Okay, so that's what the importance of omega 3s are. So now this is where I want to kind of hopefully you can see this picture and get some ideas about what a good omega 3 supplement is there. First of all, the dosage. So dosage has to be minimum of 1,000 to 2,000 milligrams of EPA and DHA on the daily basis. Okay, and this is only EPA and DHA. So how the supplement industry fools you is that once you buy your omega 3 supplement, they will say omega 3s in total are 1,000 milligrams. Okay, no, there are several different kinds of omega 3s. Research only shows that EPA and DHA are the ones which are most beneficial. Okay, so that's the reason you have to specifically look at the label. So over here, I'm showing this label over here with you, and you can clearly see omega 3 fatty acids, and then they actually break it down to EPA and DHA. And then you can just add both the EPA and DHA, and that should be a minimum of 1,000 to 2,000 milligrams of EPA and DHA. That is going to give you that enough amount of omega 3s to actually make an effect. Now, time and again, there are research studies which come out, well, omega 3s don't do anything. They did not lower cholesterol. They don't improve heart disease. The problem is that those research studies are not using proper omega 3 supplementation. Again, they are just using a minimum omega 3 supplementation, which is not focused on EPA and DHA. So that's where if you're using omega 3 supplement which doesn't have enough of EPA and DHA, you're literally wasting your money. Okay. So that's the reason. Look for the label. If you are taking omega 3, go home today, or like look at your bottle right now and look at that if it is telling you exactly EPA and DHA dosage. And once you add them, and if you can get that level of 1000 2000, that's what you want to take. Okay, so that's the first foundational supplement. Omega 3 is very, very important to lower inflammation in the body. The second one is magnesium, right? The magnesium is the master mineral. It basically takes part into 300 enzymatic processes in your body. It regulates NF kappa B. Okay, NF kappa B is a master regulator of inflammation in the body. Okay, and by magnesium participating in certain enzymatic processes, it can influence this NF kappa B. Okay, so that's the reason this magnesium is so important. The worst part is this: 50% of population is deficient in magnesium. Okay, so most people are not checking it. Obviously, even the blood tests are not perfect. So that's the reason magnesium is very, very important mineral. As a foundation, everybody should be taking it. Some food sources are spinach, pumpkin seeds, almonds, dark chocolate. These are all good sources of magnesium that you can take. The problem is that from these food sources, the absorption of magnesium is poor. The second problem that was there, which was a research study which was done recently, which compared the magnesium content in our food, like spinach, as well as, in pumpkin seeds from 1980s. It showed that it was significantly lower. These spinach and pumpkin seeds are significantly lower in magnesium mineral right now as compared to 1980s crops. Okay, so that's the problem, that even the healthy food now these days, because the soil is poor with these minerals, your food will also be lower in the quantity. So that's the reason. But the magnesium is really important. And this is where, as I was talking to you before, magnesium form is very important. Most people are using magnesium oxide or magnesium carbonate. Those are really bad. Please don't use them. The three forms of magnesium which are really good is magnesium glycinate, magnesium citrate, and magnesium threonate. Okay. So the reason being, magnesium alone is excuse me. So as I said, magnesium alone is poorly absorbed. Okay, so they combine with this, a compound, sometimes glycinate citrate, to improve the absorption of magnesium into your bloodstream. So glycinate is the best form for majority of the people because it is really good absorbed, much better absorbed than any other form. It is really good for sleep, good for stress, good for thyroid. So in general, it is a very good magnesium in total. Magnesium citrate is good for people who have constipation issues. Okay, because again, magnesium citrate will make you regular. So if you have constipation, then only use magnesium citrate. Otherwise, magnesium glycinate is good. And then magnesium threonate, which I have not mentioned over here, but magnesium threonate is the third form, which is mainly helpful for people with brain fog issues. Okay, so that is a little bit more better working for people with brain fog, magnesium threonate. Otherwise, magnesium glycinate works really good for majority of the people. Okay, dosage is typically 400 to 600 milligrams daily basis. The good part is that magnesium, you cannot overdose it most of the time. Okay, so and most people will need this amount of magnesium. So yes, that is again the next foundational supplement that you should include. Vitamin D, right? Everybody knows about vitamin D, which they should be, because literally it is not even a vitamin anymore. We consider it as a pro hormone because it takes, like regulates more than 2000 genes in your body, right? So that's really, really big. It, essentially is immunomodulator, basically takes part in different immune regulation. Deficiency of vitamin D, several studies have shown that those people have high inflammation chances, high chances of thyroid problems, high chances of autoimmunity. So definitely vitamin D is one of those vitamins everybody needs. The problem, the one source of vitamin D is sunlight. Okay, and most of us are not getting enough sunlight exposure. Even though you are outside, you are covered from head to toe, right? So when our skin is not getting exposed to sunlight, then we do not make vitamin D. That's the reason world over everybody is low in vitamin D. So if you are even have an ounce of doubt, go and get your vitamin D levels checked. Like around 70 to 80% world over are low in vitamin D. So make sure you are taking it. Some food sources like fatty fishes, eggs, and mushrooms, if when they are being produced, if they have given enough sunlight exposure, then they can make some inherent vitamin D that you can consume. But those are the only food sources of vitamin D which can give you some vitamin D, but otherwise it doesn't. That's where the supplementation is important. Now, this is where I recommend doing vitamin D with vitamin K2. A lot of you might already know this synergy, but if people who don't know, is that when you combine vitamin D and vitamin K2, it improves the absorption of vitamin D. Plus, the second thing it does is that vitamin D improves calcium deposition in your body, but it will also do calcium deposition in your arteries also. So, to improve that, K2 basically gets all your calcium out from your arteries and actually deposit it to your bones. This is where your calcium should be going. But if you're taking your vitamin D without K2, that's where you might have some deposition of calcium in your arteries and less calcium deposit in your bones. And plus, less vitamin D also get absorbed from the gut when you're taking it without K2. So that's the reason combining with K2 is very important for vitamin D. So that way you can get the best of overall things. Dosage. Dosage can vary anywhere from 3,000 to 5,000 international units. A lot of people are using very low amount of vitamin D, like only 500 or 1,000 international units, which generally will not get them to the optimal range of vitamin D, because most of the labs, if you will look at them, the range is anywhere from 30 to 100. That's a very big range. I like most people to be in the ranges of 40 to 60, because that's the optimal vitamin D range. So if you're not in that range, increase your vitamin D. The second thing is that it works better when you are actually doing a fatty meal or if you're taking the omega supplement, because that helps in absorption of vitamin D. Okay, so that's the reason in a day, if you're taking omega as well as vitamin D, that works really good. And plus, vitamin D, requires magnesium as a cofactor to activate it. So again, if you're taking magnesium on the same day as vitamin D, it works better because they synergistically activate both of them each other. So that's the reason vitamin D is very important for immunity and reducing inflammation. Now, the tier 2 supplements, these are very targeted therapeutic support. Okay, these are actually specific supplements which have shown in several research studies that they are very targeted for autoimmune diseases and inflammation people. One of those is curcumin. Everybody knows curcumin or turmeric, right? Turmeric is an Indian spice. It is kind of a foundation to Indian cooking. And curcumin is the active ingredient in turmeric, because of which the turmeric has all the health benefits. Okay. And there are at least 5,000 research papers which shows the benefit of turmeric in whole bunch of health diseases. For inflammation, it works really, really great. In fact, it has been compared with a lot of medications like ibuprofen and another NSAIDs, and they have seen similar results with taking curcumin and NSAIDs. So very, very powerful supplement for reducing inflammation. Definitely, you should take this if you have too much inflammation in the body. It basically works on, again, NF-kappa B and IL-6, again, two mediators of inflammation. So a very, very nice thing to do. Now, again, curcumin itself alone is not very well absorbed. Only 30% of curcumin get absorbed. But once you combine with black pepper, or if you combine with other antioxidants, all right, sorry about that. So, so as I was saying, if you combine turmeric with either black pepper or if you combine with other antioxidants, then the absorption of curcumin is better. So most formulations are now using black pepper, but even better is that once you combine curcumin with other antioxidants like quercetin, like boswellia or gingerols, then they actually synergistically work with each other. So, or if you're taking turmeric as a food, then you use black pepper with it. But if you're taking it as a supplement, there are different newer versions, which either it is liposomal curcumin or nano particles of curcumin, or combining curcumin with other antioxidants is the newest way. Now, a lot of people think, well, why, I'm eating turmeric every day on the daily basis, so, that should be helping me. Well, no, not really. The problem is again the dosage. The dosage of curcumin needs to be between 1,000 and 2,000 milligrams on the daily basis for it to function as an anti-inflammatory. If you're just taking for health purposes, yes, turmeric is fine. But if you're using it for reducing inflammation, you need this amount. And if you're eating 1 teaspoon of turmeric, okay, which is a good amount of turmeric to eat, 1 teaspoon of turmeric only has 200 milligrams or 300 milligrams of curcumin. So just imagine you have to eat 5 teaspoons of turmeric each and every day to get 1,000 milligrams of curcumin, which is too much. Most people will have stomach upset. So that's the reason they never see the therapeutic benefit of turmeric in reducing inflammation. This is where supplementation will be useful, that you need to get a supplement which will have this amount of curcumin, or either it is combined with other antioxidants which work similarly, so that the dosage of curcumin is needed less, because other antioxidants basically support the work of curcumin. So curcumin being another very important supplement you should take. The next one is boswellia. This is not actually very well known in the Western world. This was actually used in Ayurvedic medicines as an ancient healer for a long time. So very popular in Ayurvedic medicine. But now Western science is also looking at it and have shown research studies, like head-to-head research studies, especially in arthritis, IBD disease like Crohn's disease, ulcerative colitis, as well as thyroid, especially Hashimoto's, that boswellia is really very good because it reduces leukotrienes, which are other inflammatory mediators. So very important, or very nice boswellia. The dosage is between 200 to 400 milligrams of boswellia on the daily basis. That will help you in reducing inflammation in the body. Then comes resveratrol. Now, resveratrol is this, like the wine, right? A lot of health benefits of the wine we have known for centuries. Why wine is healthy is because of this resveratrol compound. Okay. It basically is a very powerful antioxidant that reduces inflammation in the body, especially, supporting brain health and your heart health. So that's the reason resveratrol is really good in that way. The problem is that obviously if you drink too much wine, then you are getting the negative effects of alcohol, and then it surpasses the benefit of resveratrol. Okay, so that's the reason you have to take it as a supplement. Yes, if you are drinking a glass of wine, like once in a while, you get some resveratrol. But if you're looking to reduce inflammation, then resveratrol compound has to be taken itself, not through wine. Okay. So again, very, very great supplement. The dosage of resveratrol typically will be around 400 to 600 milligrams on the daily basis to get you the therapeutic benefit. Now, this is where I want to show you this supplement, as you guys already might be aware of InflammaPro that I've created. So this supplement, what it does is that it combines all of these different antioxidants into it. Again, the goal of showing this slide is that how you evaluate your supplements, okay? Because the power is when you combine things, okay? Because as you saw, curcumin works on NF-kappa B. Boswellia basically works on leukotrienes. Resveratrol works on antioxidants. Quercetin, which is another antioxidant, which is present in like apple skins and things, which has shown in a lot of research studies to improve cytokine storms. So now basically this way you're targeting all the different pathways of inflammation. So that's the reason this InflammaPro is a great supplement. So whenever you are buying your inflammation reducing supplement, see if you can buy combinations like these. Okay, like 2 or 3 different inflammation reducing supplement in one bottle. So that works better because now you are targeting multiple pathways. Okay, but obviously then what happens is that when you reduce it, when you are combining things, then you can reduce the dosage of those things also, because they are working with each other and enhances the absorption of each other also. Okay. So that's the reason InflammaPro is there. But again, this is the way you can look at other supplements, which is boswellia, quercetin, resveratrol, and curcumin. And, you can take them all separately also. Absolutely. That is perfectly fine. But make sure you're getting the required dosages and required forms. So those are the tier 2 supplements. Tier 3 is basically systemic support. Okay. What else do you need to do, right? Gut inflammation. We already spoke about gut, but I just wanted to bring it over here that if you remember, 70% of your immune system is present in your gut, right? And leaky gut is a major issue. So definitely you need to support your gut and heal your gut, right? So very important doing that. Food is a great way. Supplements is another way. Probiotics definitely is very important way to heal your gut. As you know, minimum is around 30 billion to 50 billion is what you need in the probiotic strains. and you're looking for strains like bifidobacterium and lactobacillus. Okay. So again, look at your probiotic and see if these strains are present in the probiotic that you are consuming, and if it has between 30 billion and if it has between 30 billion to 50 billion of the probiotic strains. Okay. So that's a systemic support. Okay. So this is where these three tiered supplements are there. Now, how do you, they work with each other, right? As I was saying. So how do you stack them together to kind of create a synergy so they all help each other? Because as you saw, they all are working very differently in your body to reducing inflammation. So basically, like, omegas, really good work in the morning. So I recommend them, taking with food. Along with that, take your vitamin D. That will be really good that way because they work really good together, omegas and vitamin D. Magnesium is taken best at bedtime because it works, in certain enzymes which gets activated in the night. So magnesium can do that. Plus, obviously, supports your sleep also. Inflammer Pro is a supplement which again you can do it between meals. Okay. So that way, if you're doing it between meals, that is good, but you can do it with meals also. So that is the one supplement which actually doesn't matter too much whether you take it between or with meals. But so, you can spread it out during the other times of the day. And then obviously the probiotics, you take it with food, with your dinner. So that way you're stacking these things so that they are working with each other during the whole day to get you into the anti-inflammatory, mode very quickly. Okay. So all of these supplements basically supports all the different pathways of inflammation by supporting your gut, your immune system, your hormones, your brain, and your joint health. So whichever form of inflammation is present in your body, it will take care of all those things with you. Okay. So when you kind of, start using these anti-inflammatory supplements, generally, like within 1 to 2 weeks, you will see better sleep, you will see better digestion, less bloating. Around 3 to 4 weeks is where you can start seeing some joint pain reduction and things. Between month 2 and 3 is where the magic happens. Okay. Where you will see consistently more energy, you will see less and less flare-ups of autoimmunity. Overall, you will see more mental clarity, all those things. Okay. So that's what, around 2 to 3 months is the magic time where you can see good results, with these supplements. I'm not just talking about my supplements. I'm just talking about generalized supplements. When you are making your anti-inflammatory protocol for supplements, give them at least 2 to 3 months to work on your body. Okay. So that was about all the supplements. You can buy the supplements over here also, but as I said, like you can buy it anywhere else, also whichever company you believe into. So look into these supplements. These will be good for you to add as a good regimen to support your anti-inflammation routine. And these are good for a lot of other purposes also. So I will highly recommend you to look into these supplements and start incorporating so you can get healthier also. Now, what we'll do is that we'll open up for questions. So please post your questions into the comment section so I can answer those questions for you, whatever you have in terms of inflammation related or any supplement related questions. We'll be more than happy to answer those also for you. Okay, guys. So let's get to the questions now. All right, so let's start taking some questions. So please start posting your questions into the chat section, so I can start taking them. So Jim has this question: what is the best sleep supplement for ADHD? So magnesium threonate will be a good supplement which can help really with ADHD and also with sleep. You can combine that with melatonin, and that can also be very, very useful for ADHD things. So that's what I will recommend to start off with that and see how that works. And then obviously then there are other supplements that can be added. But magnesium threonate or magnesium glycinate, you can start with either of those. Good 400 to 600 milligrams at bedtime, not before bedtime. And then melatonin is another one which is really good. But melatonin has to be taken 1 hour before bedtime. So that is something that you can try, Jim, and see how that goes. May has this question: I'm taking Synthroid now. Do I need to taper off the medicine or can I stop cold turkey? I never recommend stopping medicines cold turkey. You need to slowly taper off. But before you do that, you need to know what you're doing. What is the plan of action? how you're tapering off, what are you going to do to support your thyroid, to support other things, so that you can help your body to function even without the thyroid medications. Okay, because a lot of people think, okay, well, let me just start working, let me just stop the medicine, medicine is not my best friend, and that can backfire. So make sure you're working with a provider, or you have an action plan in place, so that way you can help your thyroid while you're tapering off of the medicine. So that's what you can do. Let's see what other questions are there. Lung allergies and inflammation. This is where quercetin is very useful for lung allergies and inflammation, because typically quercetin is very useful for allergies and also very good for kind of lung health also. Plus, obviously the ones which are mentioned over here, omega-3s are very good, curcumin is very good. So those will be very good for lung allergies. That's where you can start off with things. Female hair loss. First of all, why we are having female hair loss, right? It's very important to know, Janet. So because there are various reasons for female hair loss. It can be alopecia areata, which is a very localized hair loss. It can be because of inflammation. It can be because of thyroid, or it can be other reasons which are causing it. If, let's say, it is because of thyroid or it is because of inflammation reasons, then you need to make a plan of supporting your hair health. Now, the most people think that the hair is just about what is happening on the top, but it is actually about the hair follicles, because that's where it is providing nutrition to your hair. Omega-3s are really wonderful in that way. High dose omega-3s that definitely support the hair growth. Collagen peptides are another thing that you can do, collagen powders, which can be helpful for hair growth. If it is because of thyroid, that's where I will recommend doing selenium and zinc, which will again be very, very important for hair growth. So you can look into those, as well as going on an anti-inflammatory diet. So that will support your hair health, will be important. And again, if you do have too much inflammation in your body, that's where, going on a blend of anti-inflammatory supplements like curcumin, boswellia, quercetin, gingerols would be good. So that way it can reduce inflammation in the hair follicles and help it to improve. If you want to check out, on our YouTube channel, we have created a couple of videos regarding hair loss and hair health. So that would be useful, where I have spoken about, a couple of like a cup of drink that you can make at home that can be useful for you, and other supplements also. So anybody who has issues with hair loss or hair thinning, I will recommend you to check out those videos. That would be very, very useful for you. Okay. So Kristen has this question, like how much K2 to take with 10,000 units. So so K2, is, first of all, that's a problem with K2. Different companies and different places will have different forms of K2. Some will have MK7, some will have just plain K2 in there. So different forms are there. But around 1,000 will be a good place to start off with K2. But even if you have small amount of K2, that would be fine to use, because that also depends on what issues you are dealing with. 10,000 units of vitamin D is something that you should be careful with, especially if you're taking it on the daily basis. Make sure you're checking your levels to make sure you don't go very high on them. Michelle has this question, my pain is actually in the right knee inner joints. So for knee joints, obviously, if you do have, let's say, arthritis, which is what we call as osteoarthritis, then again, you have to see what can be done about it, especially if you're overweight, trying to lose weight will be good. But this is where this Inflammapro supplement is really good. A lot of our patients who have arthritis or joint pains, that has helped a lot, because it's a blend of curcumin, boswellia, gingerols, quercetin. Those are all good for joint pains. And then when you combine that with omega-3s and vitamin D, that kind of becomes a very powerful actually medicine for joint pains. So I will recommend trying the Inflammapro, or otherwise, if you don't want to try Inflammapro, or you are in an area where you cannot purchase it, like outside US or India, then try curcumin and boswellia. Those are two great supplements for joint pains, and then combine them with high doses of omegas. that is very, very useful for joint inflammation and pain. So I will definitely recommend you that. So that's Michelle. Sindhu has this question: thyroid eye disease, which supplements help to reduce a bulging eye and come back to normal? Well, typically we don't have much supplements, research studies to do it. So I don't want to share any information which is not supported by research. So research is not very clear. There are some eye supporting supplements, like, obviously omega-3s are good eye supporting supplements. Vitamin E is good for eyes in general. But do we have specific supplements that supports the thyroid eye disease and can reduce the bulging? We don't have a research study for it. So that's one thing about it. Let's go to the other questions. Anna has this question: what can I do if I have high ferritin levels? So high ferritin levels can be because of various reasons. One of the major reasons for high ferritin is actually inflammation in the body. So if you have too much inflammation, specifically you should look for chronic infections. Okay, chronic infections like parasites in the gut, candida in the gut, overgrowth of bad bacteria in the gut, plus looking for Epstein-Barr virus infections. Okay, so you need to look into those reasons why you have too much inflammation in the body. And typically when ferritin is high, it is either because of chronic hidden infection, or is it because of toxins in your system. So that's where you should look into that. Obviously, if you're taking an iron supplement at a high dose one, that can cause it. But typically that is not the case in majority of the people. The high ferritin levels is because of a chronic infection or high amount of toxins. So look into those things, Anna, for high ferritin levels. Stephanie asks this question: what is best for diabetes and kidney disease? Well, for diabetes and kidney disease, there is not one supplement, right? That's where you have to work on a whole protocol for it. Kidney disease, what kind of kidney disease? Because if you have chronic kidney disease, your GFR is very low. I cannot recommend you a supplement direct, because some of these supplements go from kidneys. So definitely you need to work with a functional medicine or an integrative medicine provider who can look at your labs and then suggest you supplements which are safe for you to take. Okay, because the first goal is to be safe. We don't want to recommend any supplements. We don't want to do anything that is going to harm your body. Okay, so make sure you are safer in that way. Jazz has this question: what is the best supplement for IBS? Probiotics. Okay, good quality high dose probiotics is one of the essential supplements for IBS. Then the next supplement for IBS will be something which helps with leaky gut, which is like a gut restore supplement that we have, which is a combination of L-glutamine, aloe vera, marshmallow, DGL. So those are the other supplements. If you have not listened to our last week's video, then you should go back and listen to our last week's video. This is where we discuss in detail about gut inflammation and how to heal it. Priyanka has this question: what are the best supplements for PCOS? Well, obviously there are a whole bunch of supplements for PCOS, but omega-3s are really good for PCOS. And then, as I said, curcumin is really good for PCOS. Magnesium is really good for PCOS. Vitamin B's, B for boy, is really good for PCOS. So you can try those also. But more than that, it is not about supplements. It is about working on the root cause of PCOS, which is the inflammation and also hormonal imbalances. Okay. So make sure you're working on those hormonal imbalances, which is, androgen excess, insulin resistance, adrenal dysfunction. This is what you need to work on. And I will highly recommend to you working with a professional so that you can work and improve your PCOS greatly. So that's great. Dimvyang has a question: I'm also functional medicine doctor. Well, great. I'm so glad that more and more functional medicine doctors are available or getting trained into functional medicine world over. So I'm really, really glad. Please email us. Go on our website, email me. How can I help you? Or if you just want to connect, that'll be really nice to do that. So yes, I'm really glad that functional medicine is getting the limelight it should be. This is a new modern way of healing your body from an inside out approach, utilizing great research studies and research backgrounds. So I highly recommend each and every person to look into a functional medicine provider. As you are all aware that we do provide functional medicine consultations virtually. So you can always look into working with us. But again, you can always look at local providers also if there is somebody who is there who can help you out. What lowers systolic BP? That's a big question. There is very difficult to answer it. What typically we see is that when you work on your whole lifestyle choices, reduce inflammation, improve insulin sensitivity, improve your metabolic syndrome in the body, that's where the BP gets better on its own. Generally, I'm not in favor of starting people on supplements for lowering BP, because majority of my patients, when I start working on their systemic approach of all the other things, then they get better. So I will recommend you to start working on an anti-inflammatory diet, working on insulin resistance, metabolic syndrome, and that generally should help you with your improving your BP. Shelja's question, my magnesium supplement says magnesium aspartate dihydrate. I will not recommend it, because most of the research studies are between magnesium citrate, magnesium glycinate, and magnesium threonate. Those are the best form absorbed in your gut. That's what I will recommend to use for any kind of magnesium. Donna has this question: does inflammation causes high blood pressure? Absolutely. That's what I was talking about just before, when somebody has this, when Wanda had the question about improving BP, is that you work on your inflammation levels and your BP will get better. And definitely inflammation can cause high blood pressure issues. So definitely we will recommend looking into inflammation. So there is no question that inflammation cannot cause high blood pressure. It definitely does. So Anand has a question about what is the best supplement to reduce thyroid nodules naturally. So we don't have one supplement in that. You should look into couple of videos which I have made specifically for thyroid nodules, where I share about different supplements, different drinks, but mainly working on anti-inflammatory protocol. There was a combination protocol which utilizes curcumin and boswellia and some spirulina. So the Inflammapro that we have has a lot of these ingredients. So once you combine the Inflammapro with spirulina and omegas, then a good chance is there that the thyroid nodules can be reduced. Obviously, there is no guarantees, but that's what a research study was done. So I will highly recommend you to check out that a video which we have made on thyroid nodules, which will be very, very useful, because that gives you in detail of what you need to do to improve your thyroid nodules. How to know when inflammation has stopped? Well, first of all, how do you know you have inflammation? Okay, that's the first question. If you know you have inflammation in the body, then you will know when those symptoms are gone. Okay, so typical symptoms are: you feel tired, you feel bloated, you feel swelling, you feel brain fog, you are gaining weight. Those are typical symptoms of inflammation. So if you know that your body has inflammation, then once it goes away, you will know that too. Obviously, blood work is another way. I always recommend checking your inflammation markers. One of them is HSCRP, the second one is ESR, and the third one is homocysteine. These are the typical easier markers that can easily be done in any lab world over, that can tell you your inflammation levels. These are not perfect tests, but these are at this point of time like the tests which people have access to world over. So the people can do that test for having looking at their inflammation levels. Somebody has this question: I'm consuming magnesium bisglycinate, should I replace it with magnesium glycinate? No, they are both similar. Bisglycinate and glycinate have very similar properties, so you can just continue doing that. All right, let's see. Divyang has a question: how to get your supplements in India? Well, we do have two pharmacies now. One of the pharmacies is located in the US and one is located in India. So if you go on our US pharmacy, there is a link to buy supplements in India. So you can go over there and buy supplements in India. And then our US pharmacy is based in US. So that's where we ship people worldwide from the US pharmacy. But for our Indian patients, we have created a new pharmacy in India itself. So that's what would be good. Very much interested in functional medicine, which is great. How to get forward, learn more practical aspects with you? Well, you can always email us what are your issues and things, and we can see if we can help you out. Otherwise, if you want to learn about functional medicine, there are several courses online that can be you can look into. Institute of Functional Medicine does a very great job. This is where I got certified with multiple places, but Institute of Functional Medicine is a very robust program. Alrighty. So let's see. I think we are almost into our session today. So let's see. Alrighty, I will just take maybe a couple of more questions and then we'll stop this session. For leaky gut, instead of L-glutamine, can we use NAC? Well, no, NAC is something different. It can be as an add-on, but NAC doesn't alone work for leaky gut issues. So no, you cannot replace L-glutamine with NAC. They are two different compounds and they work differently. So I will recommend you to use the L-glutamine for your improvement for leaky gut. Okay, last question about rheumatoid arthritis. I think a couple of people have asked about how treatment for rheumatoid arthritis. So definitely, as you know, rheumatoid arthritis is an inflammatory arthritis. So working on underlying inflammation is very, very important. Go on anti-inflammatory diet. Then in terms of supplements, we have good research studies supporting curcumin, boswellia, omega-3s, vitamin D. And all of those have great research studies to support that they can help with rheumatoid arthritis. So I will recommend highly those things. And so we have had several patients with rheumatoid arthritis. When they combined our omegas as well as our Inflammapro with vitamin D, they got good success with it. But as I said, all of those supplements will be very, very useful for you. So use that along with anti-inflammatory diet. Okay, so I'm very big proponent of lifestyle changes, not just the supplements. So do the anti-inflammatory diet with the supplements, with good lifestyle choices, which will be useful. If that is not dealing with it, that's where you need to work with a functional medicine provider, because there are root causes which causes rheumatoid arthritis. It can be leaky gut, it can be high toxin levels, it can be chronic infections, parasites in your gut, candida infections, overgrowth of bad bacteria, adrenal dysfunction, mitochondrial dysfunction. So all of these are root causes which leads to rheumatoid arthritis, and all of these needs to be worked at. So some people who have advanced cases of rheumatoid arthritis, they need to find their root causes, work on them, stepwise approach, and then only they get better. This is what I tell people. A lot of people who come to see us, or they have inquiries about working with me, and they say, well, I'm already taking supplements, I'm already good with my diet, what difference are you going to make? I always tell them it is not about taking the supplements, it's about why you're taking those supplements. What are you trying to address? Most people which I work with, have not addressed all of their root causes. And you have to listen to this line very, very carefully. I'm not talking about one root cause. I'm talking about multiple root causes. So you have to start understanding this concept that there are multiple root causes causing your disease. You need to work on all of them, not just one. Okay. So you cannot just work on your gut. You cannot just work on your stress. You cannot just work on your diet. You have to work on all of the root causes. Then only your disease is going to get better. So if you have not gotten better till yet, then you have not yet addressed all of the root causes, because once you address all of the root causes, you are going to feel better. Your body is going to respond to it. Your numbers are going to get better. Overall, you are going to feel better in your symptoms. So if you're not yet better, then you have not yet worked on all the root causes. So if anything out of the whole presentation, this is what is important for you to know. So start digging deeper, start working on those root causes. All right, guys. So we'll see you again next week, hopefully with more great information. Thank you for showering your love. It means a lot to us, finding time to coming over for these live sessions. Keep telling us what you like and what you don't like, and what kind of videos we should be making in the future. So that way I can kind of try to help you out more and more. So see you next time. Till the time, keep, looking at at the community section, because I try to post a lot of good information over there, as well as keep asking you questions or polls. That way I know that what are the next topics or things I should be covering. and also we keep sharing new updates over there. So until next time, take care. Bye bye. Really nice seeing you again. Bye.